Have you ever wished for a simple way to stop waking up 2 or 3 times each night just to use the bathroom? Many people have heard about acupressure for nighttime urination, but what most do not know is that almost 99% of people press the wrong spot or use the wrong technique. That is why it fails, and sometimes even makes things worse. In the next few minutes, I will show you a method that is both powerful and gentle, already tested by seniors in the United States and India with real success. By spending only 1 minute each evening to massage one very specific point, you can calm your bladder, reduce false urges, and enjoy deeper rest. This 1-minute massage, when done correctly, often brings results within just a few weeks and allows your nights to stay peaceful again. Before we begin, I want to ask where you are watching from and what time is it right now. Please share in the comments, and if you find this valuable, remember to like, subscribe, and share the video so others can benefit too. Understanding what really triggers nighttime bathroom trips after 60. As we grow older, one of the hidden changes inside the body is a decline in the hormone called ADH, or antidiuretic hormone, which normally helps the kidneys slow urine production while we sleep. When this hormone becomes weaker, the bladder fills more quickly during the night, even if you did not drink very much before bed. For older men, an enlarged prostate can gently press against the bladder, creating a constant sense of urgency. For women, shifts in estrogen after menopause make the bladder lining more sensitive, sending signals that feel urgent even when the bladder is not truly full. Habits also play a role. Many seniors enjoy a comforting cup of tea, a warm soup, or even water late in the evening. Not realizing these simple choices push the kidneys to keep working when the body is ready to rest. Some medicines, especially diuretics for blood pressure or heart conditions, add to the problem. A study from Harvard University found that older adults who lose sleep from nighttime urination face a 33% higher risk of memory decline and dementia. It can feel discouraging, but here is the hopeful truth. By understanding these causes, you already hold the first key to reducing nighttime trips and protecting both your sleep and your memory. Massage. These 3 spots to reduce nighttime urination. Naturally. Instead of forcing the body with pills or restless routines, this approach works in harmony with your natural rhythms. Let me share with you 3 points that have shown real promise for seniors in both the United States and India. Once you understand these 3 points, I will guide you through the right techniques to get the best results. Watch the video till the end so you don't miss it. The first point is called Ren 4, or Guanyuan, known as the Gate of Origin. It is located about 3 inches directly below the belly button, right in the midline of your lower abdomen. When gently massaged for 1 minute, this spot has been shown to strengthen the kidneys, stabilize bladder function, and even reduce unwanted nighttime urination. A study from Peking University in 2018 reported that stimulating this point significantly improved symptoms of urinary incontinence in older patients. Imagine placing your warm hands over this area before bedtime, breathing slowly, and giving your body a message of calm. Many seniors describe it as a simple act of care that reconnects them with a sense of control. The second point is Ren 3, or Zhongji, found about 4 inches below the belly button. This is slightly lower than Ren 4, but still on the same midline of the abdomen. Traditional medicine has long considered this spot vital for regulating the urinary system, especially in cases of frequent urination. A 2020 study published in the Journal of Urology found that acupuncture and pressure applied to Ren 3 improved nighttime frequency in postmenopausal women. For many women in America and India, this comes as a gentle reminder that their discomfort is not just aging, but a pattern that can be influenced. Even men have reported benefits, since this point calms the nerves that connect to the bladder wall. When pressed gently with your fingertips, it can feel tender at first, but with slow breathing, the discomfort often turns into warmth and relief. The third point, less known but equally powerful, is BL57, or Chengshan. This one is not on the belly but at the back of your legs. To find it, sit comfortably and gently flex your calf muscle. In the middle of the back of your leg, between the two bulging muscles of the calf, you will notice a small hollow spot. That is BL57. Massage here for 1 to 2 minutes, especially in the evening, helps relax the nerves that influence bladder contractions. A clinical trial conducted in Seoul in 2016 showed that patients over 65 experienced fewer urgent trips to the bathroom after massaging this point regularly. Seniors often tell me that this practice feels like loosening a hidden knot, allowing the body to relax not only in the legs, but also in the bladder. For many older adults, learning about these points can feel both hopeful and overwhelming at the same time. You may wonder whether such a simple act can truly make a difference after years of broken sleep, but the evidence shows otherwise, and more importantly, the practice itself is safe, gentle, and free of side effects. Picture yourself in your bedroom, after brushing your teeth, sitting quietly for a moment of self-care. Instead of anxiously waiting for the night to disturb you, you place your hands on your abdomen, massage calmly, or lean forward to press your calf. In that short minute, you remind your body that rest is still possible. So, dear friend, the solution is not about fighting age, but about working with your body's quiet language. By massaging these 3 points, REN 4 below the navel, REN 3 slightly lower, and BL57 on the calf, you can begin to retrain the bladder, calm the nerves, and reclaim your nights. It is not a miracle overnight cure, but a steady, reliable tool. And when practiced consistently, it has the power to bring back mornings that feel brighter, clearer, and full of gentle hope. How to practice acupressure at home for peaceful sleep. Let me guide you step by step so that each part feels safe, natural, and easy to follow in your own home. Begin with REN 4, also called Guanyuan, a point located about 3 inches directly below your belly button, right on the midline of your abdomen. To find it, lie on your bed or sit upright in a chair with both feet resting firmly on the floor. Place your index and middle finger together, measure 3 inches down from the navel, and gently rest your fingertips there. Once you locate the spot, press lightly and hold for about 2 minutes. Breathe deeply as you do this, slowly inhaling through your nose and exhaling through your mouth. The goal is not to cause pain or sharp pressure, but to create a steady warmth, as if you are softly reminding the bladder to stay calm. Many seniors describe this moment as a gentle anchor before sleep, almost like placing a hand over the heart to reassure themselves. After 2 minutes, move to REN 3, known as Zhongji, which lies slightly lower on the same midline, about 4 inches below the navel. This point may feel a little tender at first, but that is normal. Instead of pressing down firmly, try making small circular movements with your fingertips, massaging the area in slow, gentle rotations. Continue for about 2 minutes while keeping your breathing steady. Some seniors prefer to place the palm of their hand across the lower abdomen for more comfort, especially if they feel nervous about pressing with fingers. The purpose is to relax the pelvic nerves and give your bladder the message that it does not need to send unnecessary signals. Imagine this practice as smoothing the surface of a calm lake. where every circle of your finger softens the ripples until the water is still. Next, we focus on BL57, or Chengshan, a point located on the back of the leg. This one may sound tricky, but with clear steps, it becomes very simple. Sit in a chair or on the edge of your bed. Bend one leg slightly so the calf muscle tightens, and you will notice two rounded shapes appear at the back of your lower leg. Between these two bulges is a small hollow spot, right in the middle. That is BL57. Place your thumb or the knuckle of your finger into this hollow and massage gently downward, moving from the calf muscle toward the heel. Do this for about 2 minutes on one leg, then repeat on the other. Many elders describe this as a soothing release, like loosening a knot that has been quietly holding tension all day. By calming this point, you help relax the nerves that travel up to the bladder, reducing sudden urges at night. When you put these 3 steps together, 2 minutes for REN 4, 2 minutes for REN 3, and 2 minutes for each leg on BL57, you create a structured 8-minute routine. To reach the full 10 minutes, add mindful breathing with the 4-7-8 technique. Inhale through your nose for 4 seconds, hold the breath gently for 7 seconds, and then exhale slowly through your mouth for 8 seconds. Repeat this cycle 3 or 4 times. This pattern is well known for calming the nervous system, lowering heart rate, and easing the body into a state of rest. Combining this breathing with acupressure sends a powerful message. The day is complete, and it is time to sleep without interruption. To make the environment supportive, consider adjusting a few simple habits. Keep the lights soft and warm in your bedroom, avoiding bright screens or harsh overhead bulbs. Dim lighting signals to your brain that it is time for melatonin, the natural sleep hormone, to rise. If possible, avoid drinking large amounts of water after 7 in the evening. Seniors in both America and India often share that they enjoy tea, milk, or soup late at night, but these small comforts add to bladder pressure. Shifting them to earlier in the evening allows the kidneys to finish their work before bedtime, leaving the bladder calmer when you lie down. As you practice, remember that acupressure should never cause sharp pain. A mild tenderness is normal, especially the first few times, but the overall feeling should be one of relief and relaxation. If you find yourself tensing your shoulders or holding your breath, ease the pressure and slow down. The goal is to care for your body, not to fight it. Think of the routine as a conversation. You are gently telling your bladder, "You may rest now." If you are worried about whether you can remember the sequence, write it down on a small card and keep it on your nightstand. Step 1. Press REN 4 below the navel. Step 2. Massage REN 3 slightly lower. Step 3. Press BL57 on both calves. Step 4. Finish with 4-7-8 breathing. The entire routine takes no more than 10 minutes, less time than many people spend scrolling on their phones or worrying about the next day. So, dear friend, do not let another night pass in frustration and fatigue. Instead, create this gentle ritual, one that blends the wisdom of traditional acupressure with the calm rhythm of modern breathing techniques. With patience and steady practice, you can begin to retrain your bladder, reduce nighttime urges, and welcome back the deep rest your body has been missing. It is never too late to care for yourself in this way. 10 minutes each night is not a burden. It is a gift you give to your own health, your peace of mind, and your mornings filled with light. Let me share with you the experience of Mrs. Sita, a gentle, 66-year-old grandmother living in Mumbai. For many years, she quietly endured waking up 4 times every night, shuffling across the cool floor in the dark, her body tired and her spirit heavy. She believed it was simply age catching up with her, and like many seniors, She accepted restless sleep as her fate. Each morning, she would sit with her chai, eyes weary, and whisper that her nights felt longer than her days. One evening, after listening to advice from her doctor and learning about acupressure, she decided to try massaging 3 simple points before bed. At first, she was doubtful, pressing her belly and calves with hesitation, wondering if anything could truly help. But week after week, she stayed consistent, giving herself just 10 quiet minutes before lying down. After 4 weeks, something remarkable happened. She woke only once in the night, then slept peacefully until dawn. With a soft smile, she told her children, "My sleep has returned after so many years." Her story reminds us that change does not always require medicine or complicated routines. Sometimes it begins with patience, trust, and a gentle touch that gives the body permission to rest. Warnings and special considerations. Whenever we explore natural methods like acupressure, it is important to remember that even gentle techniques are not suitable for everyone. Some situations require caution, and being informed helps you use these practices safely. For example, women who are pregnant should avoid pressing points on the lower abdomen such as REN 3 and REN 4. These areas can influence pelvic muscles, and during pregnancy it is safer to leave them untouched. Another group that needs attention are those with active urinary tract infections. When the bladder is inflamed, the priority should be medical care and antibiotics if prescribed. Pressing or massaging in this condition will not solve the infection, and may even add discomfort. Similarly, people who have bladder tumors or kidney stones must speak with their doctor first. Acupressure does not dissolve stones or treat tumors, and in these cases, the bladder requires proper medical supervision. If you are living with diabetes, pay attention as well. Frequent nighttime urination can sometimes be an early sign that your blood sugar is too high, not just a bladder problem. In this situation, acupressure may reduce symptoms temporarily, but the real solution comes from checking blood sugar and adjusting treatment under medical guidance. Many seniors in both the United States and India discover that once their sugar is better controlled, the night trips to the bathroom reduce naturally. Those with high blood pressure or heart failure also need extra caution. Nighttime urination can sometimes be linked to fluid overload in the body, which requires a physician's care. While massaging pressure points can support relaxation, it should never replace medical evaluation. A short consultation with your doctor can ensure you are safe to try these routines without ignoring an important diagnosis. Even healthy older adults should remember that pressing too hard or in the wrong place can cause problems. If you use too much force on the abdomen, you may leave bruises or feel lingering soreness. When working on the calf muscles, excessive pressure can sometimes irritate the nerves instead of relaxing them. The rule is simple. The sensation should feel comfortable, warm, and soothing, never sharp or painful. The Cleveland Clinic, a respected medical center, has noted that acupressure is safe when done correctly, but it is not a substitute for proper medical treatment. It should be seen as a complementary practice, a way to support your body and calm your nights, not a cure-all. Imagine it like adding a gentle evening walk or a glass of warm milk to your routine. Helpful, grounding, but not the only answer. So, dear friend, if you are considering acupressure, approach it with awareness and care. Talk to your healthcare provider if you have chronic conditions, and listen to your body as you practice. Used wisely, this method can bring comfort and peace, reducing nighttime interruptions and restoring your rest. And when combined with medical advice, it becomes not just safe, but empowering, reminding you that even in your later years, you still have the ability to guide your health gently in the right direction. Nighttime urination may feel like an unavoidable part of aging, but the truth is far more hopeful than that. It is not destiny, and it does not have to steal your sleep year after year. With something as simple as 1 minute of gentle massage on the right points, your bladder can relearn calmness, and your body can rediscover the deep rest it has been missing. Many seniors in both America and India have shared that this small habit brought back hours of uninterrupted sleep, renewed their energy, and restored a sense of control they thought was lost forever. Imagine closing your eyes tonight with confidence, knowing that you have given your body a gentle tool that encourages peace rather than struggle. So I invite you to try this routine tonight. Practice for just a few minutes, then notice how your nights and mornings begin to change. After 1 week, share your experience in the comments below, because your story may give hope to someone else quietly searching for relief. And if you found this video helpful, please press like, subscribe, and share it with a friend or family member who may be facing the same challenge. May your nights be calm and your mornings full of light. Done.